Hello, I'm Dr. James Wilson, and today I'm going to share something that could completely change the quality of your sleep. And I mean that literally. If you're waking up 2, 3, even 4 times every night to use the bathroom, you're not alone. Studies show that over 50% of adults over 60 experience this problem. But here's what most people don't know. There's one simple bedtime habit that research shows can reduce nighttime bathroom trips by up to 50%. I'm not talking about medication. I'm not talking about expensive treatments or complicated medical procedures. This is something you can start doing tonight that costs absolutely nothing. In the next 30 minutes, I'm going to explain exactly why you're waking up at night, what's really happening in your body, and most importantly, this one evidence-based strategy that can help you sleep through the night again. We'll look at the science behind nighttime urination, which the medical community calls nocturia. I'll share what recent research from major medical institutions tells us works and what doesn't. And I'll give you a clear step-by-step action plan you can implement immediately. By the end of this video, you'll understand how to take control of your nighttime bathroom trips so you can finally get the restful, uninterrupted sleep your body needs. Because better sleep means better health, more energy, and a higher quality of life. Let's get started. First, let's talk about what's really going on when you wake up multiple times at night to urinate. A nocturia, the medical term for excessive nighttime urination, is defined as waking up 1 or more times during the night because you need to use the bathroom. According to the National Institute on Aging, this condition affects between 50% and 80% of older adults. Now you might think this is just a normal part of aging. And while it's common, it's not something you simply have to accept. More importantly, frequent nighttime bathroom trips can seriously affect your health in ways you might not realize. The Sleep Foundation reports that people who wake up 2 or more times per night have significantly worse sleep quality. Poor sleep is linked to increased risk of falls, cognitive decline, depression, cardiovascular problems, and even higher mortality rates in older adults. Here's a startling statistic from the Journal of Urology. Adults over 65 who wake up twice or more per night have a 21% increased risk of falls. When you're getting up in the dark, half asleep, trying to make it to the bathroom, that's when accidents happen. So why does this happen more as we age? Several factors are at play. Our kidneys become less efficient at concentrating urine as we get older. The bladder's capacity often decreases, holding about 30% less than it did in our younger years. Hormonal changes, particularly reduced production of antidiuretic hormone, mean our bodies produce more urine at night instead of during the day. Medical conditions become more common too. Enlarged prostate in men, weakened pelvic floor muscles in women, diabetes, heart disease, and sleep apnea can all contribute to nighttime urination. Many medications that seniors take can increase urination. Diuretics for high blood pressure are the most obvious, but other medications affect bladder function in less obvious ways. Here's the biggest misconception I hear. If I'm waking up to urinate, I must be drinking too much water before bed. While that's partially true, the solution isn't as simple as just cutting out all evening fluids. In fact, if done incorrectly, that can lead to dehydration, which creates its own serious health problems for seniors. Another common myth: this is just my bladder getting old. Nothing can be done. Research published in the British Journal of Urology International shows that behavioral modifications can reduce nighttime bathroom trips by 40–50% in many people. You absolutely can improve this situation. The key is understanding the science behind what works and implementing the right strategy at the right time. That's what we're going to do today. Before we continue, an important reminder. While I'm sharing evidence-based information, everyone's situation is different. If you're experiencing sudden changes in urination patterns, pain, or other concerning symptoms, please talk to your doctor. These could be signs of underlying conditions that need medical attention. So what is this one habit that research shows can cut nighttime bathroom trips in half? It's called the fluid front-loading method, a strategic approach to timing your fluid intake throughout the day. Here's how it works. You consume the majority of your daily fluids in the morning and early afternoon, then gradually taper off as the evening approaches, stopping completely 2 to 3 hours before bedtime. A study published in the Journal of Clinical Sleep Medicine followed 150 adults over age 60 with nocturia. Those who implemented this timed fluid intake strategy reduced their nighttime bathroom trips by an average of 48% within 2 weeks. That's nearly cutting the problem in half with one simple change. But this isn't just one study. Multiple research institutions have confirmed these findings. The Mayo Clinic conducted a similar trial with 200 participants and found a 52% reduction in nighttime urination. The American Geriatric Society published findings showing that fluid timing was more effective than many medication interventions for certain patients. Let me break down exactly how to do this, step by step. Step 1. Calculate your daily fluid needs. Most seniors need about 6 to 8 cups of fluid daily according to the National Academy of Medicine. Now, this isn't a one-size-fits-all number. Your individual needs depend on several factors. Body weight matters. Generally, you need about half an ounce of fluid per pound of body weight. So if you weigh 150 pounds, that's about 75 ounces, or roughly 9 cups. Climate and season affect your needs. If you live in a hot climate or it's summer, you'll need more. Air conditioning and heating can also dehydrate you more than you realize. Activity level is important. Even moderate activity like gardening or walking increases your fluid requirements. Medical conditions change the equation. If you have kidney disease, heart failure, or certain other conditions, your doctor may recommend different fluid intake levels. Some people need more fluids, some need less. This is why talking to your doctor is so important. Medications play a role too. Some medications require you to drink more water, while others may necessitate fluid restriction. Here's what many people don't realize. This daily fluid total includes water, tea, coffee, juice, milk, and even the water content in foods. That bowl of soup at lunch counts. That orange you had for breakfast counts. Foods like watermelon, cucumbers, tomatoes, and lettuce can provide significant fluid intake. Many seniors actually drink too little during the day because they're worried about nighttime trips. This is a critical mistake. When you're dehydrated, your urine becomes concentrated. Concentrated urine irritates the bladder lining, making you feel like you need to go more frequently, not less. It's counterintuitive, but drinking too little can actually worsen the problem. The Cleveland Clinic found that seniors who were chronically underhydrated had more bladder urgency and frequency than those who maintained proper hydration with the right timing. Step 2. The front-loading schedule. Here's the recommended timing based on research from the American Urological Association. This schedule has been tested in clinical trials and shown to be most effective. Morning window, upon waking to 10 a.m. Consume 30-40% of your daily fluids. If you need 8 cups total, that's about 2.5 to 3 cups in this 4-hour window. Why this works? Your body has been without fluids for 7 to 8 hours while you slept. You're naturally dehydrated. Your kidneys are ready to process fluid efficiently. Starting your day with good hydration helps your organs function optimally and gives you energy. Practical tip. Drink a full glass of water when you first wake up before your morning coffee. Have another glass with breakfast. If you take morning medications, that's another opportunity for fluid intake. Midday window, 10 a.m. to 2 p.m., another 30-40% of daily fluids. This is your main hydration window. Why this works? This is when your body is most active and your metabolism is working hardest. You're processing nutrients from meals, moving around, and your body is efficiently handling fluid intake. Practical tip. Keep water with you during this time. Have a glass with lunch. If you go for a walk or do activities, drink before and after. Many seniors find it helpful to finish a specific water bottle by 2 p.m. each day. Afternoon window, 2 p.m. to 5 p.m., the remaining 20-30% of fluids. This is your tapering window. Why this works? You're giving your body the last significant hydration before beginning the wind-down period. You're not cutting off fluids suddenly, which can trigger dehydration anxiety and actually make you want to drink more later. Practical tip. Have your afternoon snack with a beverage. If you exercise in the afternoon, hydrate accordingly, but try to finish by 5 p.m. Evening window. After 5 p.m., minimal fluid intake. Just small sips if needed with medications. Why this works? This gives your body 4 to 5 hours before bedtime to process any remaining fluid in your system. Research shows this is the minimum time needed for most adults to significantly reduce bladder filling overnight. Practical tip. If you must take evening medications with water, use just enough to swallow your pills, typically 2-4 ounces maximum. Measure this amount so you know what it looks like. Before bed, 2 to 3 hours prior. Complete fluid restriction except for necessary medication sips. Why this works? The Cleveland Clinic's research shows this allows your body enough time to process and eliminate excess fluid before bedtime, while maintaining adequate hydration throughout the day. Let me give you a specific example. Say you typically go to bed at 10 p.m. Your schedule would look like this. 7 a.m., large glass of water upon waking, 8 Oz. 7:30 a.m., coffee or tea with breakfast, 8 Oz. 9 a.m., mid-morning beverage, 8 Oz. 11 a.m., water or juice, 8 Oz. 12:30 p.m., beverage with lunch, 8 Oz. 2 p.m., afternoon drink, 8 Oz. 4 p.m., small beverage, 4 Oz. 7 p.m., stop all fluids except small medication sips. That's roughly 52 ounces or 6.5 cups, properly distributed throughout the day. Let me explain what's actually happening in your body that makes this strategy so effective. Your kidneys need approximately 90 to 120 minutes to process a cup of fluid and produce urine. This is called renal processing time. When you drink a glass of water, it doesn't instantly become urine. It goes through your digestive system, gets absorbed into your bloodstream, circulates through your body delivering hydration to your cells, and then eventually the excess is filtered by your kidneys. By stopping fluid intake 2 to 3 hours before bed, you give your body sufficient time to complete this process and allow you to empty your bladder before sleep. But there's more to it than just processing time. Research published in Neurourology and Urodynamics shows that our bodies have a natural circadian rhythm for urine production. In healthy adults, the body produces less urine at night, sometimes 50% less than during daytime hours, due to higher levels of antidiuretic hormone, also called vasopressin. This hormone tells your kidneys to concentrate urine and produce less of it. It naturally rises at night, which is why children eventually stop bedwetting as their bodies mature this hormone cycle. However, as we age, several things can disrupt this natural rhythm. Antidiuretic hormone production often decreases with age. Medical conditions like diabetes, heart disease, and sleep apnea can interfere with this hormone cycle. And here's the key point. Late evening fluid intake can override this natural protective mechanism. When you drink fluids late in the evening, you're essentially forcing your kidneys to process liquid when they're supposed to be in conservation mode. You're working against your body's natural rhythm instead of with it. A fascinating study from the Journal of Physiology tracked 24-hour urine production in older adults. Those who consumed most fluids before 3 p.m. produced 65% of their urine during daytime hours. Those who drank fluids evenly throughout the day, including evening, produced only 55% of urine during the day, meaning significantly more nighttime production. What counts as fluid and what doesn't? This is where many people get confused. Everything liquid counts toward your daily fluid intake. But some things count more than you might think, and some have additional effects beyond just their fluid content. Water is the obvious one. But tea, coffee, juice, milk, broth, and soup all count fully toward your fluid intake. Here's something that surprises many people. The old myth that coffee doesn't count because it's a diuretic isn't really true. Yes, caffeine has a mild diuretic effect, but research from the American Journal of Clinical Nutrition shows that regular coffee drinkers develop tolerance to this effect. The fluid in coffee still provides hydration. However, and this is important, you still shouldn't drink coffee after 2 p.m. because of its bladder-stimulating effects and impact on sleep quality. Fruits and vegetables contain significant water. According to research from the European Journal of Clinical Nutrition, watermelon is 92% water, cucumbers are 96% water, lettuce is 95% water, and oranges are 87% water. A large apple contains about 6 ounces of water. That salad you had for lunch contributed to your hydration. This is actually good news because it means you're probably getting more hydration than you thought, even if you're not drinking large quantities of beverages. Now let's talk about beverages and foods you need to be especially careful with in the evening. Caffeinated beverages. After 2 p.m., caffeine is both a diuretic and a bladder stimulant. It increases urine production and can trigger bladder contractions, making you feel like you need to urinate more urgently. The Journal of Clinical Sleep Medicine reports that caffeine has a half-life of about 5 to 6 hours in most adults, though this can be longer in seniors whose metabolism slows down. This means if you drink coffee at 4 p.m., half of that caffeine is still in your system at 10 p.m., potentially affecting both your sleep quality and your bladder. Research from the International Urogynecology Journal found that caffeine intake after 2 p.m. was directly correlated with increased nighttime urination frequency in adults over 60. If you love your afternoon tea or coffee, consider switching to decaffeinated versions after 2 p.m. Many people find they enjoy the ritual and warmth of the beverage just as much without the caffeine. Alcohol in the evening. This is a big one that many seniors don't realize. According to research from the Sleep Research Society, alcohol suppresses antidiuretic hormone production. Remember, this is the hormone that tells your kidneys to produce less urine at night. When you drink alcohol, you're blocking this natural protective mechanism. Alcohol also disrupts your sleep architecture. You might fall asleep faster, but you'll have more fragmented sleep and more frequent wakings. When your bladder signals even slightly, you're more likely to wake up because you're not reaching deep sleep stages. A study in the Journal of Studies on Alcohol and Drugs found that even one alcoholic drink in the evening increased nighttime urination episodes by an average of 35% in adults over 65. If you enjoy a glass of wine or beer, try having it earlier in the day, perhaps with lunch or in the mid-afternoon, rather than with dinner or in the evening. High-sodium foods and drinks before bed. This is something many people don't know about. Salt causes fluid retention during the day. Your body holds onto water to dilute the sodium in your bloodstream. Throughout the day, while you're upright, this excess fluid pools in your legs and ankles due to gravity. But once you lie down at night, this retained fluid is no longer pulled down by gravity. It circulates back into your bloodstream and then needs to be processed and eliminated by your kidneys. This is why many people produce large volumes of urine in the first 2 to 3 hours after lying down. A groundbreaking study in the Journal of Urology followed seniors who reduced their sodium intake by just 25%, from about 3,400 milliliters daily to 2,500 milliliters daily. These participants decreased their nighttime urination frequency by an average of 30%, even without changing anything else. Common high-sodium culprits in senior diets include processed foods, canned soups, deli meats, frozen dinners, salty snacks, and restaurant meals. Many people don't realize that seemingly healthy foods like bread, cereal, and vegetable juice can be surprisingly high in sodium. The American Heart Association recommends that seniors limit sodium to no more than 1,500 to 2,300 milliliters per day. This isn't just good for reducing nighttime urination, it's also important for blood pressure, heart health, and kidney function. Practical tip: if you're going to eat something salty, do it at lunch rather than dinner. This gives your body maximum time to process the sodium and eliminate the excess fluid before bedtime. Important medication considerations. Now, I know what some of you are thinking, but doctor, I take diuretic medications in the evening for my blood pressure or heart failure. This is absolutely something you need to discuss with your doctor before making any changes. Diuretics, water pills, are prescribed to help your body eliminate excess fluid. They're commonly used for high blood pressure, heart failure, and kidney conditions. These medications work by making your kidneys produce more urine. The timing of these medications can significantly affect nighttime urination. The American Heart Association states that for many people, taking diuretics in the morning or early afternoon, typically before 4 p.m., can reduce nighttime urination without compromising the medication's effectiveness. However, some people are specifically prescribed evening diuretics for medical reasons. Your doctor might want the medication working overnight to reduce fluid buildup around your heart or lungs. In these cases, nighttime urination might be an unavoidable trade-off for important cardiovascular protection. Never, ever change your medication timing without consulting your doctor first. But do have this conversation. Bring it up at your next appointment. Many doctors are willing to adjust timing if it's medically safe to do so. Other medications can also affect urination. Alpha blockers for prostate problems, certain antidepressants, antihistamines, and even some blood pressure medications can influence bladder function. A comprehensive medication review with your doctor or pharmacist can identify if any of your prescriptions are contributing to nighttime urination. Medical conditions that require special consideration. Some people have medical conditions that require regular fluid intake, and the fluid front-loading method needs to be modified for safety. If you have a history of kidney stones, your doctor has probably told you to drink plenty of water throughout the day to prevent stone formation. This is still important. You can still front-load fluids, but you might need to consume small amounts later in the day as well. Work with your urologist to find the right balance. Urinary tract infections can cause increased urination and urgency. If you're currently experiencing UTI symptoms, focus on treating the infection first, then implement this strategy once you're better. Certain bladder conditions like interstitial cystitis or overactive bladder may require personalized approaches. The general principles still apply, but you'll need guidance from a urologist or urogynecologist. If you have heart failure, your cardiologist needs to be involved in any fluid management strategy. Some people with heart failure need to restrict overall fluid intake, while others need to maintain specific intake levels. This strategy can still work, but medical supervision is essential. People with diabetes should also talk to their doctor. Uncontrolled blood sugar can cause increased urination regardless of fluid timing. Getting your diabetes well managed is the first step, then fluid timing can provide additional benefit. Beyond fluid timing, supporting strategies that multiply results. While fluid front-loading is the primary habit we're discussing, research shows that combining it with other evidence-based strategies creates even better results. Let's look at 4 additional techniques that work synergistically with proper fluid timing. Strategy 1. Leg elevation in the afternoon. Here's something many people don't know that can make a huge difference. Fluid pools in your legs during the day due to gravity and natural circulatory changes that occur with aging. This is called peripheral edema, and it's more common in older adults, especially those with venous insufficiency, heart conditions, or who spend a lot of time on their feet. When you lie down at night, this accumulated fluid in your legs gets released back into your bloodstream. Your heart circulates it, your kidneys filter it, and you produce urine, often in the middle of the night when you desperately want to be sleeping. A study published in the Journal of the American Geriatric Society tested a simple intervention. Participants elevated their legs above heart level for 30-60 minutes in the late afternoon, between 3 and 5 p.m. This allowed their bodies to process the accumulated leg fluid while they were still awake. The results were significant. People who added afternoon leg elevation to the fluid front-loading method reduced their nighttime bathroom trips by an additional 15% compared to those who only changed fluid timing. How to do this? Sit in a recliner with your feet up, or lie on your couch or bed with pillows elevating your legs above your heart. You don't need to do anything special. Watch TV, read, do a crossword puzzle, or just rest. The key is keeping your legs elevated for at least 30 minutes, ideally 45-60 minutes. You might notice you need to urinate during or shortly after this elevation period. That's exactly what you want. You're processing that fluid during the day instead of at night. Check with your doctor if you have circulation problems, blood clots, or certain heart conditions before starting leg elevation, as there may be specific precautions for your situation. Strategy 2. Complete bladder emptying techniques. Many seniors, particularly men with enlarged prostates and women with weakened pelvic floor muscles, don't completely empty their bladders when they urinate. This residual urine means the bladder fills up faster, leading to more frequent urination, including at night. The American Urological Association recommends a technique called double voiding. Here's exactly how to do it. When you urinate before bed, take your time. Don't rush. Make sure you're relaxed. How do you think you're finished? Wait 20-30 seconds. Then lean forward slightly and try again. You might be surprised that more urine comes out. Stand up, walk around for a moment if able, then sit back down and try one more time. Research published in Urology Nursing found that people who practice double voiding before bed increase their first undisturbed sleep period by an average of 90 minutes. That's an hour and a half of better sleep just from this simple technique. For women, pelvic floor physical therapy can be incredibly helpful. A specialized physical therapist can teach you exercises and techniques to improve bladder control and emptying. Many women don't realize this type of therapy is available and covered by most insurance plans. For men, particularly those with benign prostatic hyperplasia, enlarged prostate, talk to your doctor about your options. Sometimes medications can help improve bladder emptying. In some cases, minimally invasive procedures may be appropriate. Strategy 3. Bladder training during the day. This technique has strong research support and can significantly improve bladder capacity and control. The principle is gradually increasing the time between bathroom visits during the day, which trains your bladder to hold more urine comfortably. Research published in the Journal of Wound, Ostomy, and Continence Nursing shows that bladder training can improve bladder capacity by 30-50% over several weeks. Here's how to do it safely and effectively. Start by keeping a bladder diary for 3 days. Note the time of each bathroom visit during the day. Calculate your average time between voids. Set a goal that's 15-30 minutes longer than your current average. If you're going every 90 minutes, your first goal might be 2 hours. When you feel the urge before your scheduled time, use distraction techniques. Do deep breathing, think about something else. Engage in a task that requires concentration. Use pelvic floor exercises, Kegels, to help suppress urgency. For women, tighten the muscles you would use to stop urinating. For men, tighten the muscles you would use to stop passing gas. Hold for 3 to 5 seconds, then release. Repeat 5 to 10 times when you feel urgent. Gradually increase your interval by 15-30 minutes every week until you're comfortably going 3 to 4 hours between bathroom visits during the day. Important caution. This doesn't mean ignoring your body's signals or holding urine for dangerously long periods. If you feel pain or extreme discomfort, go to the bathroom. The goal is building healthy capacity, not causing harm. Many people have developed a habit of going to the bathroom just in case, before leaving the house, before a meeting, whenever they see a bathroom. While this seems logical, it can actually train your bladder to signal urgency at smaller volumes. Breaking this habit and responding only to true bladder fullness can improve nighttime capacity as well. Your 7-day action plan. Let me give you a concrete plan to implement this strategy starting today. This is a gradual approach that allows your body to adjust and helps you identify what works best for your individual situation. Days 1 to 2 assessment phase. Keep a detailed fluid and bladder diary. This is the foundation of your success. Track everything you drink, the type of beverage, the amount, and the time. Track every bathroom trip, including nighttime wakings. Rate whether each urination was a small, medium, or large volume. Note any patterns. Are you drinking most fluids after 6 p.m.? Consuming caffeine late in the day? Eating salty dinners? Having alcohol with dinner? Pay attention to how you feel. Are you thirsty at certain times? Do you drink out of habit or actual thirst? This baseline data is incredibly valuable. It shows you where the problems are and later helps you measure your progress. Days 3 to 4, begin front-loading. Start shifting your fluid intake earlier. Don't worry about perfecting the timing yet. Just begin drinking more in the morning and early afternoon. Set phone reminders for morning and midday hydration. Many seniors forget to drink enough early in the day because they're not thirsty yet, or they're busy with morning routines. Try to stop drinking fluids 3 hours before your typical bedtime. If you go to bed at 10 p.m., make 7 p.m. your cutoff. This might feel strange at first. You might feel thirsty in the evening. That's normal when you're changing habits. The feeling usually passes within a few days as your body adjusts. Continue your bladder diary. Compare these days to your baseline days. You might see improvement already, or it might take a little longer. Days 5 to 7, refine and add supporting habits. Fine-tune your fluid schedule based on how you're feeling and your bathroom patterns. Add afternoon leg elevation if you notice ankle swelling or puffiness in your legs by evening. Even 30 minutes makes a difference. Practice double voiding before bed. Make this part of your bedtime routine. Continue tracking in your diary to measure progress. Most people see noticeable improvement by the end of the first week, but some take 2 to 3 weeks. Be patient with yourself. Questions to ask your doctor. Schedule an appointment to discuss your nighttime urination. Bring your bladder diary. Doctors find this information extremely helpful. Here are specific questions to ask. Can we review the timing of my diuretic medication? Would taking it earlier in the day be appropriate for me? Are any of my other medications contributing to nighttime urination? Could we adjust dosages or timing? Based on my health conditions, is the fluid front-loading method safe for me? Should I be tested for conditions like sleep apnea, diabetes, or prostate problems that might be contributing? What's a realistic goal for nighttime bathroom trips given my medical history? Are there any treatments beyond behavioral changes that might help me? Should I see a urologist or urogynecologist for specialized evaluation? What to prepare for your appointment? Create a comprehensive medication list including prescription drugs, over-the-counter medications, and supplements. Include dosages and timing. Bring your bladder diary covering at least 3-5 days. The more data, the better. Write down your questions beforehand so you don't forget them during the appointment. Note any other symptoms you're experiencing. Difficulty starting urination, weak stream, pain, burning, or blood in urine. Setting up your environment for success. Create your personalized hydration schedule. Write it down and post it somewhere visible. Your refrigerator, bathroom mirror, or beside your favorite chair. Set up hydration stations. Keep a water bottle or glass at your desk, favorite chair, and anywhere you spend time in the morning and afternoon. This makes it easier to remember to drink during your front-loading windows. Remove temptations from evening spaces. If you typically keep a water glass on your nightstand, move it to your morning location instead. Prepare evening alternatives. If you're used to sipping tea or water in the evening, find other comforting activities. Many people realize they were drinking out of habit or for comfort, not actual thirst. A warm bath, Reading, gentle stretching, or other relaxing activities can replace the evening beverage ritual. Stock your kitchen with bladder-friendly beverages for daytime: water, herbal teas, low-acid juices. Avoid or limit bladder irritants like citrus juices, tomato juice, and carbonated beverages if you notice they affect your urgency. Resources and support. The National Association for Continence offers free resources on bladder health at their website, nafc.org. They have educational materials specifically designed for older adults. The American Urological Association provides patient guides on nocturia, including detailed information about treatments if behavioral changes don't provide enough relief. Visit their patient education section at urologyhealth.org. Many hospitals and medical centers offer pelvic floor physical therapy. This specialized therapy can be incredibly helpful for both men and women dealing with urinary issues. Ask your doctor for a referral. Support groups, both online and in person, connect you with others managing similar challenges. The National Association for Continence hosts online forums where you can ask questions and share experiences. Medicare and most insurance plans cover treatment for urinary problems, including physical therapy, medical evaluations, and certain procedures. Don't let cost concerns prevent you from seeking help if you need it. Measuring your success. After 2 weeks of implementing this strategy, compare your bladder diary to your baseline. Look for reduction in number of nighttime bathroom trips, longer first sleep period before waking, smaller urine volumes at night, larger volumes during the day, feeling more rested in the morning. Reduced daytime urgency. Remember, improvement takes time. Most research participants saw significant results within 2 to 4 weeks, but some took longer. Every person is different. Stay consistent, be patient with yourself, and don't give up if you don't see immediate results. Some people achieve complete resolution, sleeping through the night with no bathroom trips. Others reduce from 4 trips to 1 or 2, which still significantly improves sleep quality. Any improvement is worth celebrating. Let's recap the key points from today. Nighttime urination affects over 50% of seniors and significantly impacts sleep quality, fall risk, and overall health. But it's not something you simply have to accept as an inevitable part of aging. The fluid front-loading method, consuming most of your daily fluids before mid-afternoon and stopping intake 2 to 3 hours before bed, reduces nighttime bathroom trips by up to 50% according to multiple clinical research studies. This isn't a theory, this is proven science. Support this habit with afternoon leg elevation to process accumulated fluid during waking hours. Practice double voiding before bed to ensure complete bladder emptying. Consider bladder training during the day to improve capacity. Track your progress with a bladder diary. This simple tool provides valuable insights and helps you measure improvement. Most importantly, remember that while this strategy helps many people, everyone's situation is unique. Work with your healthcare provider to rule out underlying medical conditions and ensure this approach is safe and appropriate for your specific health needs.